I want you all to help me out here. Listen to what this person has to say about their situation right now and let me know what you think. All right, so you were saying, so you found out at 12 weeks by you having the test. You went to the pregnancy center. So they did an ultrasound as well then?
And they confirmed.
And they agreed with the dates?
And then I started making calls
Okay.
to the doctor's offices to try to get people, but the doctors that I were calling weren't accepting patients at the time. So I waited until they were, which was like maybe 3 weeks down the line.
Okay.
And then by that time, they were saying they couldn't accept me because I was too far along. So every doctor I called after that was, oh, you're too far along, we can't accept you. And then I went to hospitals, like when I would feel like something was going on, I would just go to the emergency room. And they, at the time, they showed me my test results, but they never really told me about the diabetes situation.
Did they take blood and everything? So that it may have shown already in the blood work?
But you
never got any copies of the information?
Yeah, no.
When you get discharged from the ER, they're not saying, here's a copy of your records or...
No, not the blood work or anything. They just would tell me, you know, I came in with my chief complaint and they would tell me basically, gave me paperwork on my chief complaint. They didn't never tell me, okay, well, it looks like your sugar's high in your urine.
So any of your test results, you don't know them?
No.
Or your ultrasound results?
I don't know that either. So then I started feeling bad, and then I went to the hospital again, and they did the same thing again. Saw me up to labor and delivery, checked the baby, and I was like, okay, well, I don't think it's the baby. I feel like it's me, because I'm the one feeling the worst. The baby seems to be fine when y'all check the baby. And then I waited a couple weeks more, like maybe 2 weeks more. And then finally I was like, okay, something doesn't add up. And I kept, when they said my sugar was up in my urine, I was like, okay, well, if my sugar's up in my urine, then it has to be up in my blood. And then I kept going down, because I have that little app on my phone, the little hospital app. I downloaded that and started looking at my records, and they were like ketone something. And I was like, I don't know what that means either, but that's obviously a problem too. So then I decided I'd go back to the emergency room, but this time I was like, okay, don't worry about the baby this time, just look at me. If sugar's up in my urine, then it has to be up in my blood. Is there any way you can test my blood to see how high my sugar is? And when they tested it, it was like 464.
Oh no.
So they had to admit me to the hospital then. So that's how I found out I had the diabetes. And that was just a couple weeks ago. So, but other than that, when I was trying to look for doctors, I would call someone and they would be like, oh, well, we're not accepting you. And then I'd give up for a minute, a couple weeks, and then I'd call again. And then they'd be like, oh, we're not accepting patients at the time. And then I'd be like, okay, well, let me call someone else. And then they wouldn't accept me because I'm too far along. And, the further along I got, the more they would say, well, we can't accept you.
Of course, each time you're further.
So,
what was the earliest time frame they said that was too late? Was it 16 weeks?
They told me 15.
15 weeks, okay. And at this point, you're 34 weeks, right? Okay. How did you find us? Tell me how you found our clinic.
The Orlando hospital.
They made the referral?
Yeah, they made the referral, and they was like, you can call this person because they accept you at any given week.
Yes, exactly.
And I was like, okay, well, I'll call her then.
Thank goodness. Well, I'm glad you're here. She had so many gems inside of that story, one of which was the fact that she said she kept going to the ER. So that meant records were being produced, labs were being drawn, results were in. But because she didn't have a medical provider or a medical home, which she couldn't get, even though she was trying, she was then shut out of her system. So this is the biggest issue, and her story covers all of these angles. She has insurance. Medicaid though it may be, it's insurance. She has means to get to these ERs to get seen. She has wits about her that say, I need to take care of myself and my baby both. She has knowledge to use the apps. She has enough savviness to get in and see her own results and try to make sense of them by herself. She has enough information to keep going back, asking in a way that empowers herself to ask, but also empowers the providers to respond. She did all the things. And she gets to 34 weeks pregnant And still, at that late stage, she's just now getting help in terms of a referral to our clinic, at least, because everybody knows our clinic will not turn her away. But how do you get to that point where at 34 weeks, you're still shut out of a system and no one will help you enter that system to do the best thing for yourself and your baby? In this day and age, at this time and at this place, a story that's actually her reality. That is the truth of her situation right now. That is her experience. That is her lived experience. We are at a state now where we are saying we are aggressively addressing maternal mortality, maternal morbidity, infant mortality. And yet nothing could be further from the truth when people are still in this situation as she described just now. We have to ask ourselves a question. What are we doing? This is why I want to ask all of us to think a moment, stop a minute and think very thoroughly. We need a perinatal pause. We need to stop and say, hold up, something else has to happen here. Something very different we need a pivot, because this cannot go on. This cannot stand. Just by really the skin of her teeth, this person's baby is still alive. Is still there. The heartbeat was positive when we listened yesterday, but just as easily it might not be. She was and is at this point still an uncontrolled mother having gestational diabetes, and no one is coming to help. No one is there standing in the gap with her. This is wrong on so many levels. Let me know what you think. Put some comments in the comments section. Let's have a conversation. What are we doing?